Here in Marion County, 1 out of every 4 people face a form of food insecurity, and what that looks like is going to bed with an empty stomach. One of the best ways to address food insecurity is through the charitable food system, which we know as food pantries. And these food pantries serve as a valuable asset to our community because it's a place to get not only food, but healthy and nutritious food. It's also a place to get health-related resources, and it's also a community gathering place. At Community Health Network, we're committed to the community and improving the health and well-being of the community. And one of the ways that we're doing that is by addressing food insecurity. And one of the ways that we're doing that is a multi-pronged approach by partnering with the Marion County Public Health Department, Indie Hunger Network, and of course, the food pantries.
Indie Hunger Network is a local nonprofit. We run multiple different programs aimed at different aspects of the food system, but all of the work we do, including our work with food pantries, ladders up to our ultimate goal of reducing food insecurity in central Indiana. Indie Hunger Network has been working to strengthen and support food pantries basically as long as we've been in existence. We work with food pantries because they're a vital part of the food system. Food pantries are able to provide food to people for acute needs, if you need food right now for something specific, but they can also provide food for chronic needs if you're needing extra food regularly. There's no wait list, there's no application period, you can immediately get assistance, and they serve as centers for getting connected to other resources as well. Food pantries do a great job of helping to put food on the table, but unfortunately it's not always the healthiest food. We know that food insecure people want to eat more healthy foods, and we want to help them be able to do that. And that's where our partnership with REACH comes in, is helping to equip food pantries to be better able to provide those healthy foods to the people they serve. Since partnering with REACH, we've been able to prioritize nutrition more in our work with pantries, and there are many different ways that we've worked with pantries to improve nutrition. Some of the most important examples that come to mind are buying pantries pallet jacks so that they can source larger amounts of food, increasing refrigeration and freezer capacities for pantries to have healthy foods on hand, offering cooking demos or recipes or other nutrition information about pantry food, and rearranging the flow of the pantry to encourage people to select healthier options. Food insecurity impacts all kinds of people, but it impacts some people disproportionately. We know that Black residents in Marion County experience hunger at 2 times the rate of the general population. So in our work with food pantries, we really try to prioritize working in high-need neighborhoods, as well as partnering with pantries that are representative of the communities they serve.
At BU Wellness Network, our mission is to enhance the health and wellness of the Black communities in Indiana. We do serve all communities and all are welcome. The REACH grant partnership has been a success because it has provided our staff the education to be able to maximize the potential of our client assistance pantry. We have seen tremendous growth in our clients, and we have seen tremendous growth in the health and wealth of our community.
BU Wellness Network is one of the only places within a 4 or 5 mile radius that offers fresh produce twice a week, and that will be on Tuesdays and Fridays. As a peer navigator myself, I've been able to walk the area a couple of blocks around, especially on Tuesdays and Fridays, and sharing with the communities what we have to offer. And oftentimes, many people will follow me back and come and receive these fresh produce items. The Client Assistance Program is important to me now because we have fresh produce, and we have a lot of wonderful options, and then we have a team of workers who continue to show us how to eat better. The food pantry has afforded me more healthier food choices. For example, just this morning, I made a sauteed spinach and mushroom omelet. Those items came from our pantry that I received this past Friday.
Food pantries are essential for community wellness because, simply put, people need to eat. People need to eat healthy. They need to be able to fuel their bodies to be able to get out into the world, and the community pantries are providing that space for them to come in a judgment-free zone, to gather, to get information, and to be able to go back and supplement what they can get from the rising costs of groceries and that they get from the store.
I am very excited about the work that has been done in addressing food insecurity. We have been able to move the dial forward, and a lot of hard work has been put in, but there still is a lot of hard work to be done.
In the last few years, we've been able to work with about 60 food pantries to implement nutrition-related improvements, and we've really seen that work has made an impact. The number of people who report that they're always able to eat nutritious meals has almost tripled since before we started this work, and the number of households who say they can rarely or never eat nutritious meals has been cut in half. So we know that this work is working. There's just more to be done. This isn't a problem we can solve overnight, and so we have to continue funding this work to make sure that people can access the nutritious food they need.